Hello, friends. Welcome back to the 15th edition of What the Facts, the most frequently asked questions about nutrition. Now, last week I covered supplements. I talked about vitamin D and um, omega 3 and vitamin B12. I started off with vitamin B12, the most important if you're eating whole food plant based or if you're vegan. And a little discussion about iodine, and I talked about colon cleanses. So if that perks your interest, check that video out. I didn't talk about turmeric. That's not considered actually an essential supplement, but important probably for people that are having chronic inflammation, that want to reduce their risks for Alzheimer's disease, which is the topic of today. Did you know that this week, this month, is Alzheimer's Disease Awareness Month? I had forgotten. I won't go there. But it is a very near and dear topic to my heart. I did mention in the last video, and I believe in other videos, that both my parents suffered from dementia. My father from Lewy body. He passed a couple of years ago. And my mom, who still is challenged by having Alzheimer's disease. So for the last several years, I've studied Alzheimer's and dementias intensely. So what I want to do is present to you some information that I gained mostly from some experts in neurology. Both of them are expert researchers in neurology. They've published books and they've given presentations all over this country and world. They're all over the internet, YouTube. That's Dr. Dean and Dr. Ayesha Sherzai. They're married. They're located in California at Loma Linda, and they have a ton of data, and they really are helping to meet the cause for reducing risk for Alzheimer's disease. So that's what I want to go over, because millions, probably billions, of dollars have been spent looking for that magic pill, that magic injection, and really they've not gotten very far. There's some promising research using monoclonals, focusing on amyloid and these tau proteins that are involved. These are the plaque proteins that are involved with Alzheimer's, but far from prime time. And the pills that have been around for a long time do not significantly slow the progression once you have Alzheimer's. And there certainly is no cure, nowhere near a cure. But for many years, studies have been done now, for the last more than a decade at least, that have shown that lifestyle and diet can play a huge role leading up to the diagnosis. Because about 20 to 30 years before the diagnosis is evident, you're building up to it. Things are going on in the brain and the blood vessels that are leading up to Alzheimer's disease. And then a few to sometimes several years before the diagnosis, you have something called mild cognitive impairment. Now that used to scare me a little bit, because I would think when I'd come upstairs in my home and forget what I came up to get, or when I kind of lose track of my car when I made a trip to the grocery store, I come back out, I'm like, where the heck is my car? Or spend 20 minutes looking for my keys or the remote. I thought, okay, I'm losing it. This must be Alzheimer's. But you know what? That's normal for aging. So if you all experience those things, that's all right. You know, you want to get concerned when you lose your keys because you've put them in the freezer, or when you can't find your car all night in a grocery store that you frequent. Or perhaps when you go home from a job you've been going to for years, driving the same route, and you come home one night, and you can't find your way home, then you should be concerned. Don't worry, but you should be concerned. That's mild cognitive impairment, maybe a little more than mild, that last example. At any rate, the Sherzais, these wonderful neurologists, have an acronym. Now, you know, I have my own acronym for health, and it covers Alzheimer's also. If you follow it, that's fearless, for food and exercise and avoiding toxins and restorative sleep and lessening stress and engaging your mind and social energy and spiritual connectivity. But these astute doctors have their own acronym that really focuses on reducing the risk for Alzheimer's. And it's called Neuro, Neuro. So they start with nutrition. Nutrition, plant based. Here we go again, plant based. But I'll say this, and this didn't come through on my last video. I kind of rammed it home, importance of whole food plant based. But it's not an all or none thing. You don't have to be totally 100% whole food plant based, no animal products to move the needle. A lot of people just aren't there yet. If you're 80, 90%, you're still going to be moving that needle. And so just strive for it. My own personal feeling, because of all my risk factors, not limited to the Alzheimer's, but to how long males live in my lineage and without disease, and the history of people having strokes and colon cancer. That's my drive to reach something highlighted by Dr. Joel Fuhrman called, he says, trying to achieve nutritional excellence. So that's what I try to achieve in the best way I can. But that's me. That may not be you. So really, if you just greatly increase the uptake of fruits and vegetables from the standard American average diet, which is about 2 servings, to maybe 6, 7, or 8, you're going to make tremendous gains, even if you're still eating some meat or fish. So, of course, if you're vegan, it's a whole different concept. That's a social justice movement, which I evolved into. But that's not everybody. And if you're trying to really enhance your health, you may want to take gradual steps and just try to get there, where you really focus on what you need to increase in your diet. So, in for nutrition, and really plant-based. Really less egg, meat, and dairy. Those saturated fats have been shown to really increase your risk for Alzheimer's. Saturated fats mostly come from animal products, but you can also get them in some plant-based products, like from palm oil. So read those labels in processed foods, or coconut oil. That's a big thing now. A lot of people are, coconut oil for this or that because it's from a plant. It's loaded with saturated fat. And cheese, which is an animal product, has a ton of saturated fat. So if you're really looking to reduce your risk factors for Alzheimer's, and that's one pathway through Alzheimer's is through lipid metabolism, what your body does with fats, then you really want to greatly reduce your intake of saturated fat and cholesterol. And eggs are loaded with cholesterol and saturated fat. So I've already gone through many of the other tenets of eating foods that are mostly plant-based. So I'll go away from that N into the E, which is exercise. That's in my acronym also. And the Sherzais, Dr. Sherzai and Dr. Dean and Ayesha Sherzai recommend at least 20 to 30 minutes, 6 or 7 days a week of exercise, including the legs. Dr. Dean Sherzai really emphasizes use of the legs. They're next to the heart. They're the most important pumps. They are pumps that pump blood massively up against gravity. So working out those legs, you don't need an insanity workout. Just a brisk walk will do. But that is enough. If you sit down at a job for 8 hours at a time, he says that really almost negates it. So you need to get up, stretch those legs, do a few squats if you're able to. While you work, at least every hour, move those legs around. Go to the washroom that's furthest away from you. Take a walk. Do a little something at work if you can. That's exercise. The U is for unwind, and unwinding means dealing with stress. Organizing your day can take a lot of stress out. And Dr. Dean and Dr. Ayesha Sherzai go into details. I'm going to post links to their presentations. You really should check it out. They go into much detail, but unwinding is an important thing so that you don't have to stress. And there are, of course, many other ways you can reduce stress. The R is for rest. My R is for restorative sleep. Sleep is important. If you're getting less than 7 hours sleep, that's bad for your brain too, and that's going to increase your risk for Alzheimer's. So you need good quantity sleep. You need good quality sleep. So your brain can put those things you learned all day into files and have them there so you can remember them the next day, and also tone down on whatever emotional turmoil there is. That's what happens when you're sleeping, as well as enhance your creative thinking. So a lot of good things happen when you sleep. So you need qualitative sleep. And then the O is for optimizing your mind. Now, I have covered a number of these principles um, on my website, fearlessmd21.com, with articles that I've written. So it goes into much detail, plus tips about sleep, about anxiety and stress, about engaging your mind. Just in the last few weeks, I've covered those topics. But that's what their acronym, NEURAL, stands for. And when they talk about optimizing the mind, they mean doing things that are challenging, that are purposeful, and that are complex. Because just doing a crossword puzzle isn't quite enough. Learning a language, learning how to play an instrument, working on a social project, something that includes different areas of your brain that gets a workout, especially when you get to be around my age and when you're middle age or getting into your 60s or higher. Several million people in this country, about I think 5 or 6 million, suffer from Alzheimer's disease. And by time, if you're blessed to reach 85, there's a 50% chance you'll have Alzheimer's. But you can lower those chances by following these guidelines. Now, the Sherzais have something they call the Neural 9. And because I'm moving towards 12 minutes here, I'm not going to go through all of it. I'll just say into detail. The Neural 9 tells you exactly what foods they recommend that you get. So they recommend greens, they recommend whole grains, they recommend nuts and seeds, that's 4. They recommend cruciferous vegetables, they recommend berries, that's 6. They recommend herbs and spices, 7 and 8. And they recommend tea. They focus on green tea, but also hibiscus tea is very nutritional, also called red zinger. Dr. Greger speaks of that. So these are important things to consider, and definitely check out I'm going to leave links to 2 of their presentations that I particularly like. They're a little long. You can read them in segments. Listen to them in segments, view them in segments. And really, there's a lot they have to offer. But if you have an interest in really trying to reduce your risk for Alzheimer's, check it out. Other things that increase your risk for Alzheimer's are sleep apnea. So if you have a notion that you have sleep apnea, you should get a sleep study, because your risks are, I think, more than doubled if you have that. If your risks are almost tripled or quadrupled if you have diabetes. So diabetes type 2 is also a lifestyle and diet driven disease. So stick with this channel. There'll be more I'll pass on. Let me see. My tip of the week is just to make sure, since it's hot, at least where I am, to stay hydrated. People say, well, how much water should I drink? And really, if you eat a lot of fruit and veggies, you get a lot of water from those, especially the fruit now. So eat a lot more watermelon and a lot of fruit this time of the year. Any time of the year is good, but especially this. So you get a lot of water. But several glasses, somewhere 6 to 8 glasses of water is really good to hydrate. That is it. So like this channel or this video if you liked it, and certainly subscribe if you haven't already. Check out my website at www.fearlessmd21.com. I post recipes on there every Monday, and I'm on Clubhouse every Monday at 5 p.m. Central Time in a room called Authentically Plant Based, sharing a recipe. All right? Have a good week. Bye.